Welcome, welcome everybody. This is John Zager, and this is my second YouTube video in a series that I'm going to be doing. And what I'm working on is, I guess, a little bit about my background. 38 years clinical psychology. Past 5 years, I suppose, I've been working on a lot of research in psychology, neuroscience about self healing. And found that to be pretty interesting. Some of the information is stuff that been doing myself for quite some time, many, many years. I guess there's a name to it now. But it's all neuroscience, and I find it extremely interesting. There's very notable people out here that have been doing very good research and scientific studies to substantiate and prove that people have the power in a lot of cases to self-heal themselves, and I find that just amazingly intriguing. Physically, and the stuff that they go through is they talk about, four-stage cancer, diabetes, hypertension, just illnesses of all kinds that are very, very serious, and people's ability to change or alter some of that as a result of thought. We talked about some of this stuff on the last video, and I said I would do two things in each video coming up. And one would be to hit on some of the research that's going on, and secondly, to talk about the research that I'm doing personally within myself to see if in fact this stuff works. So we just basically talked a little bit about placebo and nocebo and the effects of that. The individual, there's case studies all over the internet and people that can give you all the detailed information of various cases and stuff. I just find that, based on what a person says, to a doctor says to a client, can determine the outcome. I believe there's that example that's been going around about the doctor says to the patient, you have 30 days to live, go home and get your affairs in order. And, the guy doesn't necessarily understand or believe, but he accepts the fact that the doctor knows best and goes home, tells his family, tells his friends, tells his colleagues. Everybody comes together, and this people are just taken back. He's not really acting sick, but he believed in his own mind that what the doctor was saying was accurate 100%, and so he took care of getting his affairs in order. 31st day, the guy dies. Wife says it'd be nice to get an autopsy on him. Autopsy's done, and come to find out the guy never had anything wrong with him. There was no physical evidence in the autopsy that showed he had any disease or any illness that would kill him. And um, that's the opposite effect of placebo, nocebo. It's powerful what a doctor can do to clients if they're not properly trained in the area of what and how to say things to patients. And if they misdiagnose, I mean, there's another case, and again, all this stuff is on the internet. Just go look it up. I'm just abbreviating it and not being real detailed, but a couple older gentlemen needed their knees replaced, separate places in the country, separate doctors, separate patients. That much deterioration or whatever, and the doctors went in and did different stories, different, not related together, but they did false surgeries where they just made little incisions, and when both guys came back around after surgery, the doctor went and just said, it was a totally successful operation, and you should be back to normal and feeling good, and I don't know, go play golf or whatever it is you do. The two gentlemen believed it. They had no reason to believe that they did not receive the full surgery and the knee replacement and whatever. And they recovered extremely well and went out and had all kinds of fun and became active and just marvelous recovery and playing golf and running and jogging and biking and doing everything. And they just both commented on how successful it was. And they both went back in and had, pictures taken to determine the extent of the recovery. And again, they weren't told, but in the pictures, it showed that their original knees, which were still there, never had anything wrong with them, never needed surgery. So they believed to such an extent that the placebo surgery, false surgeries were highly successful. I mean, the stories go on and on. I mean, just go listen, turn on the internet, and go find people that are talking about self-healing. My background is compulsive disorders. I'm more on the mental side. I'm not a MD or a doctor of any kind. And my treatment of patients for 38 years was around addiction, mostly alcoholism, drug addiction, all the various drug addictions, pain, medications, fibromyalgia, just compulsive disorders. And 20 some years ago, I mean, I kind of did my little routine. Excuse me for drinking coffee, but I did my little routine in doing groups and stuff with people, and part of my approach, I mean, it was much more elaborate than what I'm explaining to you, but I would say I was at the time doing a group of 17 people, you know, 3 days a week, 3 evenings a week, and working with a ton of people, ton of patients. And I had kind of come up with the idea of the placebo idea, that if I can get them to visualize in their own head, not using alcohol or drugs or whatever their compulsive disorder is, and feel the emotion and the elation behind that. And then I interjected, I would say, if you follow these 8 steps that I'm going to present to you, you can't do part of them. You can't do only 7 of them. You have to do 8, and you have to do them well. I can assure you, you will be on down the road recovering from your compulsive disorder. There's no reason for you to any longer be an addict. There's no reason for you any longer to be an addict. But you must follow these 8 principles I'm going to give you. Is that something you can do? So I just went on with that whole sort of approach. Built them up for a few weeks and got it to a point where I got a commitment from several, better than half. And the ones that followed, they surrendered to the belief that what I was giving them was going to work. They didn't think anything differently. Placebo, right? It worked. This is 20 some years ago. I don't even remember. Nowadays they're doing it mostly with physical type things, but I would guess they do it with some of the mental health issues, anxiety disorder, fibromyalgia. What the hell's that about? It doesn't exist. It's a way for doctors to make money and pharmaceutical companies to make money. Depression, anxiety, just go on down the list. I'm fairly certain that with interjecting some placebo, nocebo type effects in the interaction with your clients, you're probably going to get some sort of favorable outcome. Anyway, that's some of the stuff I want to talk about today. I could go on for hours talking about that stuff. And if anybody cares to know, just drop me a line, I don't know, underneath here in the comments or whatever, and I'll address those issues and continue to expand on stuff as we go through these videos, this video series. But anyway, here's the deal. I've been working on hypertension, right? High blood pressure, yeah, so that's cool. And what I've been doing is using the meditation techniques as near as I can understand. I haven't been able to go to the workshops or classes Dr. Joe Dispenza. I really admire that person, but I've watched every video, listened to every, I don't know, interview he's ever had, every lecture he's ever done. I've read everything of his, and I'm trying to follow his method in lowering, reducing, and eliminating my hypertension. I'm on like, I don't know, maybe 2.5 weeks of doing this every day in the evening before I go to bed. And what I do is I go through each left arm, left leg, right leg, stomach, upper lower GI, lungs, liver, kidneys, heart. You know, I go through every part of my body and talk about how the blood is flowing freely, effortlessly, in and out of each extremity or organ, nourishing those body parts very well. And that all the veins and arteries within my body are not constricted. And I spend that whole part probably takes me, I don't know, half hour, 45 minutes to do. But then I go into visualizing a vein that's constricted, that has hardened, that is callous, that is shrunk, that is wrinkled. And I visualize it becoming supple to the touch. I visualize it not being hard, where when the blood goes through, it's pressing against the walls that are stiff, but rather it has some give when the blood goes through. I mean, I do this whole visualization process of opening up a vein or an artery that may be constricted. I don't know, maybe another half hour on that. I'm not even sure. So those are two things I do, and in a lot of detail, I actually do that stuff. The other part is the pituitary gland, up over your kidneys, if I'm not mistaken. When we have thoughts of fear, for instance, it triggers the autonomic nervous system, which has to do with sympathetic, parasympathetic nervous system, and flight or flight reaction. What that does is it releases your stress hormones, right? Pituitary gland is, I'm not a doctor, but as near as I understand in my research and reading, it releases stress hormones. Stress hormones, let's say all of your veins and arteries or whatever, blood flow in your, everything's flowing open, you know, there's no constrictions, no chambers in your heart that are closed up or nothing like that. But let's say, and I'm kind of going down this road on myself, that I, through environmental and having watched modeled to me fears, which produce anxiety, right? It fires off the pituitary gland and you end up with all the stress hormone, you know, that gets released into your system. Well, adrenaline is one of them, obviously. starts coming out, and it causes a lot of things to happen. Tissue doesn't heal as well. Um, you can get hypertension. Obviously, you can get hypertension. Your immune system doesn't function as well as it can. Um, there's a lot of not real healthy side effects when your stress hormones, cortisol, why do guys have bellies? Part of the reason is that they got too much cortisol, stress hormone being fired off in their system. It's harder to get rid of that stuff. But, those two hormones in particular cause a lot of damage. So, a third part of what I'm doing in my meditation is I'm focusing on, in my mind and my thoughts, stopping the thought process of any fears that might produce anxiety, that might produce fight or flight, that would release the stress hormones. I hope you followed that. I'm really working hard at trying to stop that thought process, which in turn is a chain reaction that leads to stress hormones and, again, welcome hypertension. What I've seen so far now is that my numbers are gradually going down. Not remarkably well, but they are, I don't know, maybe they're 5 or 8 points down on the top and 5 or 8 points maybe down on the bottom. I'm not getting where I want to go, I guess is what I'm saying. But I'm doing it every day, and I'm getting a little smarter. Sorry about all this stuff. But I'm getting a little bit smarter with what I'm trying to do and accomplish. The other part is that I believe, there's a creator out there. This whole world and our bodies would not exist if it depended on man's ability to keep us running. So I try to communicate with the creator, infinite intelligence, and I'm trying to communicate with it to have it work on its side to help reduce the hypertension in the manner in which I'm doing it. And I ask for insight into better understanding the process and working jointly with it. Well, it's pretty elaborate. I'm happy. I'm very happy that progress is being made. I sincerely believe progress is being made. How long will it take? I don't know. But that's what these videos are for. This is about self-healing. Happiness, wellness, and self-healing. And I am attempting to self-heal myself of my hypertension. Now, I'm still on blood pressure medication, don't get me wrong. I haven't thrown out that, but the side effects of hypertensive medication that cardiologists give us sometimes is worse than the hypertension. And I don't know, you probably die of the side effects before you die of the hypertension. But at any rate, I'm working on both sides of that. And our bodies, I absolutely believe, are the largest pharmacies in the world, and we have every drug resource available to us if we call on it for whatever's wrong with us. So anyway, there's the progress report for this week. I will try to get another one up within the next week, and I'll give you another progress report, and I will also um, give you some more insight from a layman's standpoint, I guess a counselor or therapist standpoint. Obviously, I've been doing this for about 40 years, counseling people, and it's fascinating to me to just watch people and the ones that recover and the ones that don't, and then try to figure out the difference. Lastly, I have another sip of coffee, but lastly, I'm self-supporting. I'm not doing webinars or whatever, and my PayPal account is jzegar, JZEGAR, at gmail.com. I sure would appreciate if you could send $5, $10, $100, put it in that account. It helps me continue my research and the work that I'm doing, kind of in neuroscience, and I'm trying to interview as many people as I can to understand their process, and trying to formulate how this whole thing works and then present it back to you guys. So I feel like this is of benefit to you. Certainly can be of benefit to you. Please go, and I have nothing to do with Dr. Joe Dispenza. I admire him a lot. I don't have the money to go to any of his workshops or seminars, and if I get any money, it's first thing it's gonna do is go towards that. I think he charges around $400 or $500 to go, and I don't have that. So anyway, I sure would appreciate if you would just put money in my PayPal account, jzager at gmail.com. So thank you everybody for watching, and I look forward to seeing you the next time.